Dr. Toney Kiss Series. Missing appointments. Why is this not good? It's not good because if you are a patient, you'll understand this. When we correct the subluxation, what we're doing essentially is we're taking the bone from a position it's in, it's out of place essentially, and we're making the correction. When we make the correction, we free up that bone and the body sets it where it needs to set it. The problem is those ligaments on this side have become so stretched out that after we correct it, they're laxed and sloppy. And the ligaments on this side are already contracted, and when we straighten it, they become very taut and tight. So the likelihood is that the bone goes back out of place. That's the whole reason for multiple appointments and multiple adjustments to reteach, to reteach, to reteach. If I want to run a marathon, I'm not going to do it in 2 days. Going from nothing to running a marathon in 2 days. It's going to take time. I need to train the ligaments. I need to train the muscles. I need to train the tendons so as to hold that structure where it needs to be. When you miss appointments, you're spending more time subluxated than you are unsubluxated. That's a big deal. Because the goal of this, if you look at your schedule, the initial part of your schedule was frequent assessments. We adjust you if you need it. We don't adjust you if you don't need it. Frequent assessments. Those assessments become further and further apart. Assessments, appointments, whatever you want to call it. Those appointments become further and further apart. Why? Because you start holding the adjustment for 24 hours at a time, then 48 hours at a time, then 72 hours at a time, then 4 days, etc., etc., etc. So when you miss the appointments, inevitably what's going to happen is you're going to spend more time subluxated than you are unsubluxated. That does not help when it comes to training. Oh sure, you may have a decrease in symptoms, whatever your symptoms are, but it's not corrective in nature. You need to maintain your schedule so that you don't miss appointments, so that you get the health that you're looking for. Example, this would be the cake. I tell patients the cake analogy. If I were to bake a cake, and I wouldn't, I'd rather change a transmission blindfolded than bake a cake. But if I were, I would take all the dry ingredients together and take all the wet ingredients together and at some point mix the two together. And then start mixing with raw eggs and everything else in there. Boom, 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 I'm mixing. If all of a sudden I decide, I got something else to do. I'm going to leave this cake over here on the counter. It's summer, it's in August, there's no air conditioning in the house, and it's 100 degrees. I put plastic wrap over that cake that I mixed together, and I set it on the counter. I then come back to that cake 4 days later, and I take the plastic off and I continue where I left off. In other words, the timing's a little off here. The ingredients are correct, but the timing's off. And I'm sitting there and I'm mixing a cake. I preheat the oven, I put it in the oven. Now, will that be a good cake? No. Could it kill you? Possibly. Do you see where I'm going with this? So, I have all the ingredients there. My timing was off. Same thing here. Get the timing correct, and we'll get your structure back to where it needs to be. Missing appointments. Dr. Toney, Kiss Series.